Is your practice tired of wrestling with insurance denials, deciphering EOBs, and watching your revenue slip through the cracks? You are not alone. Welcome to The Claim Game, the podcast designed to cut through the confusion and provide you with the best practices for revenue cycle management success. We are Jeremy and Catherine Zug, and we've been with people just like you in the trenches. Each week, we'll break down complex billing processes, share real-world solutions from practices like yours, and ask questions of the game makers and changers of healthcare so you can take control of your revenue. Let's turn those claim denials into deposits and help you return to focusing on patient care. It's time to win the claim game.
Welcome to The Claim Game. I'm your host, Jeremy Zug. And if you're a CEO, a founder, or an owner of a practice or behavioral health agency that's ever looked at billing and revenue cycle management and slowly felt your soul exit through your body, then you're in the right place. We want to recap a little bit. The last time we were here, we talked about the introduction to claim submission. And this season of The Claim Game, we're going through each of the 6 domains of revenue cycle management. We're picking them apart, we're looking at their intricacies and their nuances, and we're finding what the best strategies are so that you can maximize your revenue, maximize your profit, and get back to what you do best, which is excellent patient care. So if you've spent any time in practice, you know that what you do, no matter what level of clinical work you do, it's a really important exchange that happens. There's a lot of empathy and bedside manner, there's trauma, and there's the slow, heavy lifting of human transformation. And in the work that you're doing, you're dealing with infinite amounts of complexity of human biology existing, and you're navigating a lot of what it means to be a human being. And what we want to do is make the business part of running a private practice a lot easier. So this episode, we are going to take a moment and sit down and look at translation issues and modifier usage on your claims. So let's start here. The insurance companies really don't care about the art of how you do what you do. And I know that's perhaps a hard truth, but they really care about your syntax, about how the particular encounter you have gets translated to their system. In the eyes of a payer, 60-minute breakthrough or session on a Tuesday afternoon doesn't really exist until it gets translated into their language, and their language is remarkably pedantic. A lot of leaders of healthcare organizations think that CPT codes are the whole story, and they think, I did the work, I typed the numbers in, now send me payment. But in the twisted board game that we call insurance billing, CPT codes are merely verbs. Basically, CPT codes communicate what you did. It doesn't say how you did it, where you were standing, or if you were following the 4,000-page provider manual that got updated at 3 a.m. on a Tuesday while everyone was sleeping. And the syntax, the clarifiers, the how and wheres are communicated through modifier codes. So today we're going to be zooming in on the first move in claim submission, which is understanding the language of modifiers. In 2026, modifiers are the difference between a clean claim and a Dear John letter from a payer. Without them, your CPT code is like an incomplete sentence. It's a verb without a subject, a tense, or a location. And your claim, if you submit a claim that needs a modifier or modifiers without them, that claim is dead on arrival. So let's start by talking about the matrix of context, or why we can't have nice things without modifiers. Why is this so difficult? Why can't we just have one code for, I helped a person for an hour and there was actual results that ended up happening? And this is because there's no universal translator. On our last episode, we talked about clinical logic versus biller or insurance billing logic. Clinical logic is the kind used by rational humans that want to help people, right? A 60-minute telehealth session is a 60-minute telehealth session, but Board game logic, insurance billing logic, says the correct way to bill is dictated by what we call the matrix of context. Basically, I want you to imagine a Rubik's Cube where every time you turn it, the colors change their names and also the cube is on fire, right? That's the billing environment. Your modifier usage is dictated by 4 primary variables that you as the CEO or your billing team needs to govern. So one is your industry. And let's take behavioral health, for example. Mental and behavioral health has its own secret handshakes. We have carve-outs, mental health parity laws that are more like suggestions, and codes that don't apply to your local podiatrist or cardiologist. If a podiatrist uses a modifier wrong, maybe they lose payment for a single claim. But in mental and behavioral health, if you get a modifier wrong, you could lose a month of payroll. So it really matters. So your industry governs your modifier, but also your insurance partners govern your modifiers, right? What one payer wants, another payer doesn't want. They don't have dialects. They have territorial disputes, if that makes sense. One might want 95 for a telehealth session. The other wants GT, and the other wants a third modifier, right? These payers we're going to remain nameless, but basically they want you to follow their specific rules of processing a claim. So your industry matters, your insurance partner matters, but also your geography matters. State mandates change the board all the time. What works in Kansas will get you laughed at in Missouri. This isn't just about what state you're in, it's about what state the patient was in during the session. And if they crossed state lines, that really matters. The other variable that dictates your modifier usage is your license type. And this is kind of a big one in the mental and behavioral health space. Whether you're a LCSW or a psychologist determines if the insurance company treats your claim like a VIP claim or a nuisance. Some payers require a modifier specifically to identify who provided the service. Because let's be honest, they want to pay you 15% less if you don't have a doctorate, right? And modifiers are used as gatekeeping in a way. So you want to make sure that you have the rules correct. So your industry, your insurance partners, your geography, and your license type all dictate modifier usage. So if you're a CEO staring at a screen wondering if you need to use 95 or GT, or if you're guessing which location code covers a client sitting in a Starbucks parking lot, you're already a little bit lost and behind, and so we want to get you caught up. And I would call that not billing, right? I would call that gambling with cash flow. And I really think in 2026, the house always wins unless you have a system that is more obsessed with the details than your insurance partners. This episode is brought to you by Jane, a practice management software and EMR built to support you in the day-to-day work of running your practice. If you're a health or wellness practitioner, you already know the care you provide starts well before your client arrives and extends far beyond the treatment room. Jane is there to support you in every part of that experience. With online booking, your clients can book at a time that works for them. And with features like notifications, they'll even be able to grab last-minute openings when they pop up. It's an easy way to keep your schedule full while getting your clients the care they need. During your appointment, Jane's AI-powered documentation feature can help you thoughtfully take notes so you can stay present with the person in front of you. And after appointments, you can end your time together on a healing note, not a transactional one, by charging the card on file. To learn more about how Jane can support you and your clients, head to jane.app/demo. And one last thing, if you're ready to get started with Jane, you can use my code in the show notes for a 1-month grace period on your new account. So let's move from ambiguity to certainty here. The days of knowing a guy at the insurance company are really over, and you cannot memorize the matrix, right? The AI-driven batch denial bots used by insurance companies are probably going to be much faster than you are. They don't sleep. They're programmed to find any reason, a missing hyphen, a misplaced modifier, a slight breeze in the wrong direction. I don't know, but they're going to find a reason to kick your claim back and keep that cash in their high yield accounts for another 30 to 60 days. So you need a modifier usage guide. So we have one of those on the Hourglass Learning Hub. And this is not a mental note. This is not a, well, Sarah usually knows how to do it strategy. You need a dynamic living reference that's like a Rosetta Stone in a way. So let's look at how this works in a high-performing practice. First, you list your core CPT codes. Second, you map those against every payer you have a contract with. And third, you layer on the modifiers required for telehealth, intern work, or state-specific requirements. The real power of this tool is that it's designed to be dynamic. In the billing world, static information is dead information. So when you encounter a new dialect from a payer, suddenly they love the FQ modifier, for example. You don't just complain about it over coffee, you record it, you update the guide, and you turn billing ambiguity into revenue certainty. By building this dictionary within your office, you ensure when a claim leaves your EHR and enters the clearinghouse, it speaks the same exact annoying language the insurance company demands. You're moving from a reactive, hope-based billing model to a proactive, system-based model. You're not just submitting paperwork, you're bulletproofing your cash flow. So if your AR, for example, is over 45 days, 90% of the time, your dictionary, for example, is missing a few pages. You're speaking French to someone who only understands Klingon, and you're wondering why they aren't paying the bill. All right, let's move on next to the logic of freedom and how to power that up. Let's get a little bit philosophical, and then we'll bring it back down to earth, because I know some of you are thinking, this is boring. I'm a CEO and not a coder, right? You have a vision for where the organization needs to go and a staff that feels valued. But here's the CEO level insight. Precision in your business language, in your billing language, creates freedom in your clinical language. When your billing is a mess, your organization's mind is cluttered. You're sitting in a leadership meeting talking about aging billing reports instead of talking about expanding where you want the organization to go. Your clinicians can feel stressed because their checks are inconsistent if you pay on a percentage. Your front desk is exhausted from fighting the same battle every Wednesday with a rep named Debbie at an insurance call center who doesn't know the rules either. By systemizing this process, by making the business side invisible through sheer boring accuracy, you reclaim what you're trying to do. You create a practice or an agency where the clinical work can flourish because the business plumbing isn't leaking all over the floor. Precision isn't just about money, it's about the integrity of the container you've built for your clients and your staff. A clean claim is a form of advocacy for your patient. It says we did this work and we deserve the resources to keep it going. Now, if you're thinking, okay, I have a vision and I don't want to become a lexicon, I guess, for a payer, I hear you. And I think that's exactly why we exist. We are fluent in quote unquote modifiers, so you don't have to be. And we use these tools all the time as part of our internal DNA to ensure that your work is proven to the payers using the exact logic that they demand. We like the Rubik's Cube. We're the people who actually enjoy reading the provider manual so you can focus on what you do best. So if you want to outsource billing, please contact us. Our team is eager, ready, and willing to serve your practice. So let's wrap this up with some 2026 updates to highlight why modifier usage and why it's important to be on top of it. We're going to look at one situation in particular for our friends in Missouri, but I think this is a cautionary tale for anyone else. So Optum Behavioral Health recently entered their new codes at the top of 2026. Every commercial claim has to list both a billing and rendering MPI and taxonomy codes, but they've also updated their platform to cross-reference the federal NPPES system in real time. So for example, if your data is 1% off, if your taxonomy code doesn't match what they have on file, your claim is going to be rejected before a human even sees it. And it's like being denied entry to a club because your shoes are the wrong shade of black. Really doesn't matter how great your dance moves are, you're not getting in. Also, Missouri Medicaid just updated their place of service table. This is like a classic gotcha moment. You have to distinguish between place of service code 02 and place of service code 10 on the claim directly. And this is like a subtle shift, right? One digit can cause a massive revenue cardiac arrest if you're not ready. And if you don't forget the old school traps, right? Like while Medicare typically likes modifier 9.5 for audio video sessions, modifier 9.3 for audio only, Missouri Medicaid might still be clutching onto the GT modifier for dear life, right? So you need to make sure you're not running your practice on empty, but you have a system that's in place to catch these kinds of shifts to make sure your practice or agency stays on the right track. So today we zoned in on move number 1, which is understanding the language of modifiers. We want to move from guessing to governing, and we want to move from poetry to precision, if you will. We talked about why the matrix exists and why we can't memorize it, why we need a dynamic modifier usage guide to keep your practice from being dead on arrival at the payer's doorstep. And if you're ready to stop the batch denial nightmare and give your clinical team the support they deserve, you can either go to the Hourglass Learning Hub on our website or reach out to us to take billing off of your plate. Next time we are back here, we're going to move on to move number 2, which is reviewing and preparing claims for submission, where we talk about the pre-flight checklist before we click the submit button. This is the ritual every practice needs to perform, where they hit submit, or as I like to call it, the 10 minutes that save $10,000. I'm Jeremy Zug. This has been move 1 of claim submission on the Claim Game. We will see you back here, same time, same place, to talk about our pre-flight claim checklist. Thanks, everybody. If you enjoyed today's episode of The Claim Game, please take a moment to leave us a rating and review wherever you listen to your podcasts. It really helps new listeners to find us. Make sure you never miss an episode by subscribing to The Claim Game on your favorite podcast app. Your feedback means so much to us. We want to provide valuable education about revenue cycle management. So if there's something we didn't cover in our topic that was a burning question for you, please let us know so we can try to get you the information you desire. You can find the links to all resources we mentioned in this episode in the show notes. And if you want to dive deeper into our resources, we have 2 places you can do that. First, you can go to our blog at practicesol.com/blog, where we have 8 years of educational blogs. If you want to learn more about what Practice Solutions does, reach out. We'd love to hear from you. Just go to practicesol.com to learn more and to connect with one of our awesome people on our team. Thanks for listening. We are Jeremy and Catherine Zug, and this is The Claim Game. See you at the game table next time.